What is the minimum distance you must keep from a moving crane on a construction site? A. 5 feet. B. 10 feet. C. 20 feet. D. 50 feet. Answer, D. Keeping 50 feet ensures safety from swinging loads or crane accidents, which can reach far beyond the immediate area. When handling hazardous chemicals, what is the most important step before use? A. Smelling the chemical. B. Reading the safety data sheet, SDS. C. Wearing gloves only. D. Diluting it with water. Answer, B. Reviewing the SDS ensures awareness of hazards, proper handling, and emergency procedures to prevent injury. Which type of ladder is safest for use on uneven ground? A. Step ladder. B. Extension ladder without stabilizers. C. Fiberglass ladder with adjustable feet. D. Wooden ladder. Answer, C. Fiberglass ladders with adjustable feet provide stability and reduce the risk of electric shock and falls on uneven surfaces. A worker notices a power cord frayed near a wet area. What should they do first? A. Continue working and avoid the cord. B. Report and de-energize the cord immediately. C. Wrap the cord with tape. D. Plug it into another outlet. Answer, B. Frayed cords near wet areas pose electrocution risks. Immediate de-energizing and reporting prevents accidents. During excavation, a trench collapses. What is the safest immediate action? A. Attempt to pull out trapped workers yourself. B. Evacuate the area and call emergency services. C. Enter the trench to assess damage. D. Cover the trench to prevent further collapse. Answer, B. Trench collapses are life-threatening. Rescuers should not enter without proper shoring and emergency backup. When working at heights, which safety equipment is mandatory? A. Gloves and safety boots. B. Hard hat only. C. Personal fall arrest system, PFAS. D. Earplugs and helmet. Answer, C. PFAS, including harnesses and lanyards, prevent falls from height, which are a leading cause of construction injuries. What is the maximum allowable blood lead level for construction workers according to OSHA? A. 10 G/dl. B. 20 G/dl. C. 40 G/dl. D. 50 G/dl. Answer, D. OSHA allows workers blood lead levels up to 50 G/dl. Above this, they must be removed from lead exposure. Which sign indicates the presence of asbestos on a site? A. Yellow triangle with black border. B. Blue circle with white lettering. C. Orange rectangle. D. Green square. Answer, A. OSHA uses a yellow triangle with black border to indicate asbestos hazards, warning workers to take protective measures. What is the safest method to lift a heavy object manually? A. Bend at the waist and lift with arms. B. Squat, keep back straight, and lift with legs. C. Twist while lifting to turn corners. D. Pull the object across the floor. Answer, B. Using leg muscles while keeping the back straight reduces the risk of musculoskeletal injuries. Which fire extinguisher type is appropriate for electrical fires? A. Water. B. Foam. C. CO2 or dry chemical. D. Wet chemical. Answer, C. CO2 and dry chemical extinguishers safely put out electrical fires without conducting electricity or spreading the fire. A coworker reports feeling dizzy after exposure to dust. What is the first step? A. Continue work and report later. B. Move to fresh air and notify the supervisor. C. Drink water immediately. D. Sit down and ignore symptoms. Answer B. Immediate removal from exposure and notifying a supervisor prevents further health risks and ensures timely medical evaluation. What is the minimum protective clearance from overhead power lines? A. 5 feet. B. 20 feet. C. 15 feet. D. 10 feet. Answer D. OSHA standards require a minimum of 10 feet clearance from power lines to prevent electrocution hazards. Which PP is essential when cutting metal with a grinder? A. Earplugs only. B. Face shield, gloves, and protective clothing. C. Safety boots only. D. Hard hat only. Answer B. Grinding produces sparks and debris. Full PPE prevents eye injuries, burns, and hand trauma. What is the proper procedure if a scaffold appears unstable? A. Climb carefully and adjust. B. Use it cautiously while holding the railing. C. Tag it as unsafe and notify the supervisor. D. Ignore and continue work. Answer C. Tagging unsafe scaffolds prevents usage until inspection and repair, reducing fall risk. Which of the following is an ergonomic hazard on construction sites? A. Exposure to sunlight. B. Repetitive lifting and awkward postures. C. Loud noise from machinery. D. Flying debris. Answer B. Repetitive tasks and awkward positions can cause musculoskeletal disorders over time. When is it acceptable to remove a hard hat? A. In designated safe zones only. B. When entering a vehicle. C. Anywhere if feeling hot. D. While climbing ladders. Answer A. Hard hats must remain on in active work zones and are only removed in designated safe areas to prevent head injury. What should be done if a chemical spill occurs on the skin? A. Wipe it with a dry cloth. B. Flush immediately with water for at least 15 minutes. C. Apply ointment. D. Cover with bandage. Answer B. Immediate irrigation minimizes chemical absorption and reduces the risk of burns or systemic toxicity. Which tool is safest for cutting metal on a construction site? A. Hammer and chisel. B. Screwdriver. C. Knife. D. Power saw with proper guards. Answer D. Power saws with safety guards reduce the risk of accidental cuts and debris injury. What is the primary hazard of working in confined spaces? A. Falling objects. B. Oxygen deficiency and toxic gases. C. Sun exposure. D. Noise. Answer B. Confined spaces can accumulate toxic gases or lack sufficient oxygen, posing life-threatening risks. A worker's gloves are torn while handling sharp objects. What is the next step? A. Continue working cautiously. B. Remove the gloves and finish quickly. C. Stop work, replace gloves, and report the hazard. D. Wrap fingers with tape. Answer C. Damaged PPE compromises safety, replacement prevents injury and ensures compliance. What is the recommended action when operating a forklift near pedestrians? A. Speed up to pass quickly. B. Sound the horn and maintain slow speed. C. Ignore pedestrians if you have the right of way. D. Stop engine until they leave. Answer B. Alerting pedestrians and maintaining control reduces collision risk and ensures safety. Which type of hazard does asbestos pose primarily? A. Acute burns. B. Respiratory disease. C. Electric shock. D. Eye injury. Answer B. Inhalation of asbestos fibers can cause long-term respiratory illnesses, including asbestosis and lung cancer. What is the safest way to store flammable liquids on a site? A. Near heaters for quick access. B. In open containers. C. On wooden shelves. D. In approved containers away from ignition sources. Answer D. Flammable liquids must be stored in labeled, approved containers and kept away from heat and sparks to prevent fire. Which type of PPE is mandatory when working with loud machinery? A. Hard hat. B. Ear protection. C. Gloves. D. Face shield. Answer B. Hearing protection prevents long-term hearing loss from prolonged exposure to high-decibel machinery. When should safety signs be posted on a construction site? A. Only during inspections. B. Only at entrances. C. At the end of the shift. D. Anytime hazards are present. Answer D. Safety signs warn workers of hazards at all times to prevent accidents. A worker trips over materials left in a walkway. What is the primary cause? A. Poor footwear. B. Housekeeping and site organization. C. Weather conditions. D. Lack of PPE. Answer B. Proper housekeeping and organization prevent tripping hazards and maintain safe walkways. What is the primary purpose of a lockout/tagout procedure? A. To secure materials. B. To improve efficiency. C. To organize tools. D. To prevent accidental machine startup during maintenance. Answer D. Lockout/tagout ensures machines cannot start unexpectedly, protecting workers from injury during servicing. When lifting a load with a crane, what must a CSCS certified worker check first? A. Weather conditions. B. Load weight and rigging stability. C. Operator's experience. D. Color of the crane. Answer B. Checking weight and rigging ensures the load is secure, preventing tipping or dropping hazards. Which body system is most at risk from prolonged exposure to vibration tools? A. Respiratory system. B. Circulatory system. C. Digestive system. D. Musculoskeletal system. Answer D. Continuous vibration can lead to musculoskeletal disorders and conditions like hand-arm vibration syndrome (HAVS). A worker experiences electrical shock while handling a power tool. What is the immediate action? A. Pull the worker away by hand. B. Turn off power source and call emergency services. C. Spray water to cool the worker. D. Remove the tool from the worker. Answer B. De-energizing the source prevents further shock, and emergency medical evaluation ensures worker safety.